doing much, are you?
On this episode,
I'm pretty concerned about what I'm seeing. He's blown a disc in his neck. That's stopping the signals getting from his brain to his legs. I'm really worried that Tyson in the next couple of hours will progress, and if he loses the ability to feel his limbs or breathe, we could lose Tyson.
Hey, Bill! Bill!
What's up, mate?
I need some help!
There's a snake in a banana bunch and the boys are freaking out.
Paul literally provides millions of bananas to people right across Australia. I've really got to be careful with something highly venomous.
This sort of thing just wastes so much time.
Oh, right here. Oh, it's chilling on my wrist. Oh.
but first,
Whenever he goes for a walk, he does wee like 6th or 7th time. I can see a drop of blood coming out. Loki is everything to our family.
When you see blood, it's always a
Yeah,
worry.
that's why I'm so scared. Have I done something wrong by giving?
No. It's nothing you've done.
Okay.
It's in his metabolism.
The wait is going to be really difficult. He gives the family happiness. Without him, there is no happiness. Good boy, Loki.
in Sydney's Outer West, Sanai has come to see Rob, concerned about the health of her adored Shih Tzu Maltese cross, Loki.
Hi, baby. Come on, baby. Come here. Good boy. Loki is a part of my family. I have 2 girls and Loki is my son. Loki is such an adorable and a lovable dog. Without him, our family will not be complete. Come on, Loki. Good boy, baby. Good boy. Come on. It's okay, buddy. It's okay.
Hello, I'm Dr. Rob.
Hello. Hi, Rob. This is Anna here.
And this is Loki?
Yeah, this is Loki.
This is our little man?
Yeah, he's my son, my Loki. Yeah.
Well, come on down. Let's have a look at him.
Yeah, thank you, Dr. Rob. Come on, Loki.
He's a big boy.
He is.
So what's going on with this boy?
For the past 6 months, I have observed, this has been like an ongoing thing, like on and off, on and off. Whenever he goes for a walk and he does wee like 4 or 5 times, around by 6th or 7th time, I can just see a drop of blood coming out.
Oh. Loki has blood in the urine. And that's a symptom of a lot of possibilities. Usually infection, but it can be crystals in the urine, could be stones in the bladder, could be even bladder cancer or a problem with his prostate.
I'm really worried.
I'll be honest, when you see blood, it's always a
Yeah,
worry.
that's why I'm so scared. Loki is 5 years old and just recently we just celebrated his birthday and he loves to sing. As soon as the tune goes up and down, he will go up and down. He's really someone who's special in our family.
Come on, let me hear him sing.
Yeah, sure, definitely.
Really?
Yeah, that's why that is something that he loves. It's a happiness for him. Come on, Loki. Come on, sing. He's not singing, which is unusual. He's such a happy boy. But recently I have noticed that he has become very tired and lethargic. He's not singing, which makes us a little bit worried, which is not normal. It's not normal, Loki. Yeah.
Oh, well, let's see if we can make him happy again.
Yeah, sure. Yeah.
We'll take him down and do an ultrasound. You can be there while we do that.
Oh, thank you. That would be highly appreciated. Thanks a lot, doctor.
This dog has got a presence I really, really love and admire. So I want to get him better.
He's my son. I was so worried. Okay. Good boy.
In Melbourne, Australia, a French Bulldog has been rushed into the Southpaws Hospital after suddenly losing control of his legs and collapsing.
We're going to just see what his limb function is like.
Tyson's little French Bulldog that last night went to bed and was normal, suddenly not able to use any of the forelegs this morning. Basically acute inability to walk.
Doing much, aren't you?
I'm pretty concerned about what I'm seeing. He doesn't have any function in any of his legs and he's obviously in quite a bit of pain. So something I think we need to get onto pretty quickly.
Ready? 1, 2, 3. Wait. Okay, take this.
After a range of mobility tests, surgeon Dr. Ewan performs a CT scan to confirm the likely diagnosis.
Looking at Tyson's CT, it's pretty obvious what his problem is. He's got a big bulging disc here that's popped up and is compressing his spinal cord. But what's actually happened, I think, is that he's blown a disc in his neck that's prolapsed out and is sitting on his spinal cord, and that's stopping the signals getting from his brain to his legs. Are you able to pull both of his feet backwards? Without intervention, if we let this disc go, I'm really worried that Tyson in the next couple of hours will progress. And if he loses the ability to feel his limbs, or if he loses the ability to breathe, there's a very real risk that we could lose Tyson out of this. We make our approach to the spine through the neck. We push his esophagus and his trachea and all the other important blood vessels across to one side and make our way to the underside of his spine so that we can get straight through to the disc that way and not disrupt any of the muscles that hold his head up. This is something that pops up really quickly and it gets really bad really fast, almost like a volcano. The pressure builds up so much in that disc that then it explodes out and it hits that spinal cord. Can I have some 7.5 gloves, please? I spoke to the owners. You can hear the anxiety in their voice. They're very worried, but they are very, very passionate about giving Tyson the best they possibly can. So hopefully we can get a good outcome for him. You guys ready for first incision? First incision.
I've just got off the phone to a mate of mine up here in far north Queensland. He runs a massive banana farm. He's asked me to do a crocodile survey at his farm. So I've got to jump into action. He's got 2 huge lagoons full of water that he uses to irrigate. Paul has lots of workers in around those dams and he needs to be really cautious. So it's my job to come up, survey those lagoons and make sure there's only Australian freshwater crocodiles there, no saltwater crocodiles.
As soon as he arrives, Billy wastes no time heading off to search for the more dangerous saltwater crocodiles, which kill people in northern Australia almost every year.
There should only be freshies in there. When they have these wet seasons, the water rises and there's every chance that a saltwater crocodile might come up. There's crocs everywhere today. These are all Australian freshwater crocodiles. Another one just here, that's 32, 33. Far out, there's some big boys in here today. Look at this fella with his back arched out of the water. Probably going to get a bit of rain this Ari. These crocs are going to get real worked up.
As Billy continues the massive task of a crocodile census on such a huge expanse of water,
Hey, Bill! Bill!
the farm's owner Paul arrives in need of urgent assistance.
What's up, mate?
I need some help!
No worries, mate, I'm coming in. Paul's literally one of my best mates. We go back years. Every time I come up here though, his problem has become mine. What's up, mate?
There's a snake in a banana bunch in the packing shed and the boys are freaking out. So I need you to come up and find where it is and get rid of it. We gotta go.
Just turn him around for me.
Yeah, sure.
Yeah.
This way, buddy, this way. Good boy. Good boy, Loki.
On Sydney's outskirts, Rob's about to perform an ultrasound scan on Shih Tzu cross Loki to try to find out why the 5-year-old has been urinating blood. Loving owner Sanai and her family are extremely worried about the ongoing issue.
Good boy, Loki. It's okay, bub. Loki is everything to our family. Without Loki, the day will not begin.
Okay, let's have a look. Stay there, baby. Those white things in that black area,
Yeah.
laying on the bottom of the bladder. I'd be very surprised if that's not the reason for the blood. I honestly believe that's going to be something to do with the bladder as far as stones are concerned. Not uncommon in dogs, especially smaller dogs. They look very dense, which is good news. If they were the same consistency as the bladder wall, I'd be worried about cancer. But I'm going to take a quick x-ray just to confirm it,
Yeah, sure.
so that we know where we're heading with this.
It's okay, baby. We'll fix it, okay? We'll be fine.
She's so attached to this little dog. I need to get a diagnosis so we can make a treatment plan and give this poor lady some relief. Ready? Start. Ooh. There's actual multiple calculi or stones, bladder stones, presenting in this dog, and that would certainly be the full explanation of the blood and the urine, so it's rather good because we can go in and get them out. But the first thing is to let Sinead know what's going on and take him to surgery. The x-rays confirms that what we saw on the ultrasound are stones, actual bladder stones.
Will he be fine after the surgery?
He'll have a bit of blood coming out of his urine because we're cutting through the bladder.
Have I done something wrong by
No. It's nothing you've done.
Okay.
It's in his metabolism.
So I don't know how it's going to go, and the wait is going to be really difficult. He gives the family happiness. Without him, there is no happiness. All good, buddy. We'll be fine. We'll be fine. You're in good hands, okay? There you go, buddy.
Okay.
Thank you, Dr. Rob.
First incision.
In Melbourne, Ewan is performing critical surgery to remove a damaged spinal disc from French Bulldog Tyson that's caused the 4-year-old to lose the use of his legs.
The disc that Tyson has blown is about halfway down his neck, and one of the big risks is that's where the nerves start to come off the spine that allow Tyson to breathe, so we need to be very, very careful. This is a scary surgery and it can be pretty nerve-wracking. We're using power instruments right next to the spinal cord, so it is something that you've got to put your game face on and put your emotions to the side and make sure that we're just focusing on the job at hand for Tyson. Now we need to remove some of that vertebrae, which are the bones that support the spine, to get down to the actual cord and relieve the disc. So vertical, John. This part can make you a little bit tense because we're drilling between very big blood vessels that you can't see because they're encased in bone. So the next step for us is start removing that disc out. High risk part is yet to come.
But as Ewan and his team are about to reach the damaged disc,
Has he shown any reaction to surgery at all? His heart rate came up.
Carmen, the anaesthetist, is worried Tyson's vital signs are no longer stable.
It looks like Tyson's not oxygenating particularly well. It's always a tense moment when we have these big changes on our anaesthetic machines. He's not biting down on his tongue or something, stopping it, is he? In this particular breed, French Bulldogs, as soon as we see any changes in their oxygenation, the way that they're getting air in, it's really critical to make sure that that's okay because they can go downhill really, really quickly. Anaesthetic team are just adjusting some of his monitoring so we know that he's okay. Do you need more access?
Reluctantly, the team must suspend surgery until Tyson's condition improves.
He's a big boy.
In Sydney's west, Rob's about to surgically remove dangerous bladder stones from Maltese Shih Tzu cross Loki,
It's all right, Bobby. It's all right.
as well as causing him to pass blood in his urine for months. The bladder issues have made the normally playful 5-year-old miserable. He's even lost interest in his favourite hobby, singing.
This is a really multi-talented dog.
There we go.
So I really want to get him back on his feet and back with his personality, what it was beforehand. The owner said she saw blood some 6 months ago. I suspect something's been happening even longer than that, and that becomes a worry because the actual integrity of the bladder itself may be compromised. So the next risk is to get into the bladder without spilling urine into the abdomen, and then actually getting through the bladder and making sure we get all the stones out. It's not going to be that easy. And I've got to say, Loki, there's a lot of fat in here. This bladder have a definite feel to it, especially with the stones inside, hopefully.
At first, Rob has difficulty locating Loki's bladder.
That looks like it just there. That's it there. There's our bladder. It's a pretty angry bladder, like, you know, all those blood vessels, and certainly feel the stones in there.
Rob cuts the bladder open to remove the stones.
What's going on there then? See that?
But there's an unexpected problem.
It's almost like a polyp's developed in the bladder. Oh. One of the stones is embedded in the wall of the bladder. What's unusual is that in the bladder wall, I can feel some grittiness, and removing these embedded stones, just got to be very careful. I don't want to perforate the bladder itself, so it ruptures later on. I can feel them with the tip of my finger.
Too hard to reach.
Can't get them.
There's a snake in a banana bunch in the packing shed, and the boys are freaking out. So I need you to come up and find where it is and get rid of it.
On a banana farm in far north Queensland, Billy's friend Paul has a slippery problem that's brought his banana processing plant to a grinding halt.
So we've had to just shut the show down, and I need you to have a look at all of these bunches and figure out which one has this bleeding snake in it.
Man, there's a lot of bananas there. So literally any one of these is going to have a snake in it.
Any one of these bunches could have a snake in it, and I need you to get your little mittens in there rather than me, because you're the professional here.
Paul literally provides millions of bananas every single year to people right across Australia. And time's money. So to him, to have this process shut down, he's obviously really stressed.
Honestly, it is so frustrating, and so I need you to sort it out so we can get back into it.
Righto.
I'll tell you what, I am so relieved that Billy's here today, because this sort of thing, it happens from time to time and it just wastes so much time.
Righto, mate. I don't know where to start here, but I'll get it sorted for you. I'll have a look and I'll give you a bell when I find the snake.
Thanks, mate.
Paul's giving me no direction here. He's just fast and loose out of there. There's literally hundreds of bunches to check here, and I don't even know what I'm looking for. Like, obviously I know it's a snake, but in an area like this, eastern browns, taipans, northern brown snakes are extremely common. I know it's a snake. What is it though? It could be something highly venomous or a completely harmless tree snake. I've really got to keep my wits about me here and be careful that I don't stick my hand in with something highly venomous. It's really hard to get a good look in to try and locate the snake. Snakes love to hide in the banana bunches. They go right up into the bananas and they just curl up. Next second there's a fellow cutting the banana tree down, taking that fruit into the shed. They don't know where they are. Oh, right here, right here. Right, oh, you can just see his head. He's just coming up between the bunch right there. Thankfully, it's a completely harmless carpet python. This one's only a baby. How am I gonna get you? So I'm working my way through these banana bunches, and then all of a sudden, bang! I've just found this gorgeous juvenile carpet python curled up right inside of the bunch, but it's actually really hard to get to. I might actually pull this, if I can, get this sleeve out. Maybe not.
Has he shown any reaction to surgery at all?
At Southpaws Hospital in Melbourne, surgeon Ewan and his team have been forced to suspend spinal surgery on French Bulldog Tyson because of possible breathing issues.
Breeds that have short noses can be quite challenging under anaesthetic. We do routinely have them on a ventilator that's breathing for them in surgery. Carmen, our anaesthetist, is looking pretty concerned about some of the values she's got on her monitoring, and she's just asked us to stop surgery, so it's all hands on deck right now to make sure that everything's okay with Tyson. Any luck?
I'll put this back on.
Thank you very much.
Tyson has stabilised. Ewan can now resume surgery to remove a ruptured disc in Tyson's back that is incapacitating the 4-year-old.
So we really need to keep things moving for Tyson. This disc in his cord, it needs to come out soon. But if we damage Tyson's spinal cord, we have the possibility that he may never walk again, or we can even affect his ability to breathe. And there's also some really big blood vessels in the area that if we get bleeding from them, it can be catastrophic.
We are starting to get to the very nerve-wracking part of this procedure where we start to see a little bit of bleeding. Running the risk of cutting anything inadvertent, we're very slow and meticulous about the way that we make our way down. I can see a lot of disc material in his spinal canal. We're definitely in the right spot, definitely doing the right thing for him. Now it's just about trying to tease that disc out through a very small hole without damaging anything. The material we're removing now, bit by bit, might only look like 0.5 millimeters of disc material, but when you're in the spinal cord of a little dog, you only need a few millimeters of disc material to cause you a big issue. Tyson is going to feel a whole lot better with this disc material out. There we go. That's it, we've got everything. I'm ready to finish. Thanks very much, guys.
Ewan leaves his colleagues to close up the wound.
So really happy with how that went. Lots and lots of disc out of Tyson's spine. I think he's going to feel a whole lot better now. Really good outcome for the family. I'm really hopeful that he's going to make a recovery over the next couple of weeks and be back running around.
Surgery itself is an absolute marathon, but everything's not over yet. Tyson's a French Bulldog and they can have really challenging recoveries. Things can really go south quickly with this, so it's all hands on deck, making sure that we're ready to intervene if he needs help.
Oh, stones are right down. You need to get underneath and push them up a bit, or we're not going to get there.
In outer Sydney, Rob is struggling to remove several bladder stones that are threatening the ongoing health of Shih Tzu Maltese cross, Loki.
So far down, I can't tell you. We're going to have to extend the incision.
Rob carefully cuts further into the bladder to get to the hard-to-reach stones.
Oh. The worst case scenario is if there's stones further down and they block the actual tube that goes from the bladder out of the penis. We've got to get these stones out. It just worries me that they've got these polypy looking things inside the bladder. I'll be worried about cancer until I get the report back from pathology. Okay.
Surgery has been challenging.
Okay, here we go.
But finally,
no stones. How good's that?
the stones that have been causing Loki so much distress are no longer inside his bladder.
As long as we can stop the suffering and make Loki a singer again, and make his owners happy, then it's all worthwhile. This has been dragging him down slowly, a little bit at a time. It's been an insidious process for this poor dog. So the big thing when all's said and done, when it's all finished and it's all good news, will he sing a song to me? I guess he could sing the Rolling Stones now. The
Dad joke.
There it is.
There's a dad joke in every surgery.
There's a huge sense of relief for Rob and his team.
Hang on. Ready?
But they can't relax just yet.
We will take a post-operative x-ray to make sure we haven't left any stones behind. I'm not going to leave any stone unturned, literally. I want to make sure that they are all stones in the bladder and there's nothing else, that there's no cancer or something like that. Ready? X-ray.
How am I gonna get you?
On a friend's farm in tropical North Queensland,
If I can get this sleeve out, maybe not.
Billy's struggling to remove a young snake that's embedded itself in a banana bunch, sending workers running for cover.
Sorry, Paul, I don't want to damage your bananas. It's really hard to get this snake out of the bunch. I'm moving bananas out of the way, I'm breaking them, I'm trying to pull the sleeve out. Here we go. Come on, little mate. Oh, look at him. Oh, he bit me on the leg. He's going berserko. Oh, he's chewing on my wrist. Look at that. He's got a hold of me. He doesn't realise I'm just trying to help him. So he's got a really good grip on me. He's chewing right down on the side of my wrist. He's got his coils around my arm there. He's in extreme defense mode. So he's just grabbed a hold of my wrist there, curled around, and he's actually not letting go. And for a little snake, he's got razor sharp teeth. I don't want to hurt him, you know, so I'm just slowly unwrapping him, trying to unlock those jaws from my skin. I'm trying to get him to let go of my hand. Oh, there we go. Thank you. He's going to bite me again here, so I've got to get him into a bag quickly. He's only a small python, but he's still got about 40 little needle sharp teeth in there. And you know, I'm really glad he's only this big, because in a few years' time, he'd be like 2 meters, and a bite from that size would be nasty. So you can see all the different holes where he had a hold of me and twisted and bit down, and he was really trying to send me a message.
With the feisty young pythons safely in custody.
Righto, little fella. This is much more suited for you in here, away from the bananas and biting people. I'm not going to hold that against you though.
Billy moves his banana-loving foe to a place where the anxious reptile can relax and work on the farm can resume.
And hopefully, you stay away from those bananas, you naughty little snake. I've done a good job today. I've helped this snake out, got him back into the bush, and I've helped me mate Paul out. So I reckon he owes me a few bananas. All right, good luck out there.
Okay, let's have a look.
In Sydney's west, Rob is checking post-surgery x-rays of Loki to see if he's successfully removed all of the bladder stones from the 5-year-old.
That's the bladder. Yes! All gone, no stones. That's the bladder just there, and not a stone in there. How good's that? Mick Jagger's been evacuated. All done.
After putting Loki to bed,
There you go. Baby boy, hey?
it's time to share the great news with his adoring owner Sanai, who's been praying her son will be okay.
For the past 5 years, I've never left him anywhere. Even when he was sick, like before, I used to just even sleep with him. He's everything to me.
All's well. Come in, come in.
Oh, thank you, Dr. Rob.
He's fine.
Yeah.
He's fine. He's comfortable. He's asleep. He's breathing nicely. Go to him. He's just moving his head.
Loki. It's okay, Mama. You're fine, baby.
Sinead is so attached. She calls him her son because he is just that. He's so much part of the family.
It's okay. So he'll not come home with me today?
Correct. He won't come home with you today. I know what he means to you, but if he's in pain home, he'll just be suffering through the night.
Okay. For sure, the wait is going to be really difficult, and then looking forward to see my Loki back.
So the good news is everything's out. It's all cleared out. All the stones are gone.
Wow,
the X-ray showed that. But I've never seen stones that colour.
Oh, is it?
But once Loki's home, there'll be another anxious wait for laboratory tests to determine if tissue removed from his bladder is cancerous.
So until I know what this is and hear him singing again, I won't be happy.
And we should be like, happy family again.
Good boy. Hey? Good boy.
In Melbourne, Ewan is anxiously waiting for French Bulldog Tyson to wake up after crucial spinal surgery that will hopefully enable the 4-year-old to walk again.
Come on, buddy. Give us a reading. Just before you wake up. It can be a really challenging recovery for these dogs. When Tyson got here, he was so stressed that he was struggling to breathe. We've got plenty of medications that we can use to keep them calm, but just trying to control their airway for as long as possible and recover them can be really difficult. Come on, buddy. Good boy. He says, it's nice and warm here. I'm just gonna stay here. He kind of gave me a little bit of a swallow there.
He's a good boy.
Now that he's awake, his eyes are flicking around and he already seems much less stressed than when he came in. He's just much more settled, much more comfortable, and seeing him awake after a big procedure like that, that's really what brings me into work each day.
Hey buddy. Hey buddy. Well done, buddy. You've done very well.
I'm really relieved. You know, this is not just a surgery, but this is someone's family pet and a big part of their lives. And he's got a bit of a battle. He's going to be sore tonight, but I think he's going to pull through and do really well.
Okay, bud.
Come on, Loki. Come on, buddy.
1 month after surgery to remove bladder stones,
Come on, baby.
Loki is back to the playful 5-year-old his family knows and loves. Lab results confirmed cells taken from his body were not cancerous. And with Sanaya accompanying him on the harmonica, he's again singing with full gusto. It's been 2 months since Tyson received his life-saving surgery from Dr. Ewan.
Good boy.
And the little battler has made excellent progress. To the point he is now up and about and walking, and is now back to his happy self.